So we're going to look at learning outcome 3, which is be able to plan a health promotion initiative. Now this is quite a nice one because you're actually going to be able to plan initiative. But if you remember, you did that research project on fibromyalgia.
Yeah.
You could actually use that data and just transform it into like leaflets and things. So you've got part of that has already been done for you. So most of it, this section will be easy for you. So we've got 3.1, define the rationale of a health promotion project. 3.2, seek approval, permission to carry out the project. Design materials for the project. Carry out a health promotion project and evaluate the effectiveness and impact of the project. So my laptop's been acting up for the past week or so. So sometimes it just slows down. There it is. It's back. So when we're looking at, we just want to know what a health promotion is. Now, a health promotion is just a governmental initiative. It's ideological, it's an idealistic goal, it's something that everyone's saying, be healthy or do more exercise or keep an eye on what triggers there are or, you know, just trying to work towards your health. So it is more of like viewed as a holistic concept with contextual characteristics. And then they've got contextual characteristics at like a national, local, or you know, within your locational model over here. Now, what this means is that these health initiatives will be planned depending on where you are. Now, there's in the area that I live in, we've got a high rate of families from Asian backgrounds, so India, Pakistan, over here. Now, within here, diabetes is quite rife within our cultures over here. So we've got initiatives where there's a lot of focus on diabetes and your own for weight. Maintain your weight, try and avoid diabetes. So that's what we mean when we say locational. And then you have like the national initiatives where they're trying to challenge, say, obesity within the country as a nation anyway. So they can change depending on where you are.
Yeah.
So health promotions actually enable people to increase control over their health risks and any determinants, and it's there to help you to improve your health outcomes. So for health promotions within the public, it's there to, you know, be like a social investment. It's there to help you try and produce the desired health and well-being and develop the outcome that you want across the population. So spending money on awareness and a health initiative on, say, in a locational level, you'll know that that money will actually be well spent because you'll be saving from the patients that might come in within that particular problem. So it works as well. So what are the aims and objectives of this? So a health promotion will actually focus on achieving your equity in health, and it aims to reduce differences in current health status and ensure equal opportunities and resources so that everybody can achieve their fullest health potential. So regardless if you're doing private or NHS, you should be able to get the same resources.
Yeah.
And then who is the targeted audience on here? So it's more or less it's everyone, to be honest. Children, adults, high obesity rates, communities that have a high likelihood of diabetes, elderly people, so anybody that you can think of. Vulnerable people, they're all targeted in here. Now, again, as we did with partnership working, there will be partnerships for health promotions as well. So schools, colleges, care homes, social workers, or anybody that you can think of may be partnered within these initiatives. Now, I remember you can sometimes get dentists coming into schools where they'll do a dental check on the children, but then they'll also give toothpaste and toothbrush and information out as well. So that's a partnership. Yeah. I remember attending a course, which was, it wasn't even a first aid course. I did this as a parent actually, and they just gave us some tips. The only reason I went to it is because the school secretary said to us, nobody's turning up. Can you go? So we went. It was me, my sister-in-law, and a few others of us. It was just only 4 or 5 of us. They asked us things like, how do you know your child is ill? When do you give Calpol? You know, just like basic questions that you would for a mother, parent. And at the end of it, they gave us a certificate and they gave us a thermometer, which I was buzzing about. I was like, oh, but
Yeah.
you know, I was like, look what I got, and everyone else was like, oh, we should have gone too. But it's a good initiative, isn't it?
Yeah.
So we're going on to 3.2. Is 3.1 okay about health initiatives?
Yeah, fine. Thank you.
So 3.2 is to seek approval or permission to carry out a project. So when you're actually deciding on what you want to do, you need to have approvals. So you need to, it's like you're doing a research project and you need to manage it as if you are doing a research project. So the responsibility of determining whether or not this project is classed within research is up to the, depending on how you're going to manage it. So there are different types of studies. So some of these can be deemed as research within the managing and organization aspect. And then you're going to be accepted, so like as if you're a sponsor, as if you're the person that's not just a researcher, but you're solely doing everything on your own. So when there's a project that's not going to be managed as research, you need to apply for something called a HRA approval or go to the NHS rec on here. Now, when you do with these, you've got to contact the clinical governance or research and development, so the R&D office, and then you've got to let them know what the project is, what you want to do, and discuss what sort of arrangements there might be, how you can apply it. So you've got to make sure that you follow standard guidelines and conduct like a clinical audit if you're going to be doing that.
Yeah.
So for both research and non-research, if your project involves the use of patient data without consent, you still need a recommendation from the Confidentiality Advisory Group, CAG. So you still need to get their permission, a recommendation from them. So in this section, all you're going to talk about is how you would seek approval, what steps you would go by.
Yeah.
So in total, make sure you've got consent from everybody involved. So you'll cover, again, ethical considerations like you did in your research project, data protection, respect and dignity, consent for using pictures, statistics or quotes, and make sure that there's a preset criteria in place. So you've got, little sheets and forms that they can fill out for feedback, so you know exactly how everyone is feeling. And you would do this regularly as well, especially if you're doing a project which is over a few months. So yeah. This little section and your research project, they go hand in hand with each other. There's not much difference between these. So factors that you have to consider when you're doing trying to seek approval, because obviously when you go to someone, an organization, and say this is what we want to do, they'll want to know how much is it going to cost you, how long is it going to take, what other factors are going to be put into place for you to actually do it, who's going to be involved. Is it going to be you? Is it going to be a team of people? Will there be advertising? And so on. So that was 3.2, so how to seek approval. Now, 3.3 is how to design, so design materials for the project. So depending on what your project is and what you've aimed for, you've got to figure out what sort of materials you need. So if you're doing a national initiative, a health improvement plan, you're probably going to need to create a TV advert, leaflets, newsletters, you might need booklets, or you might need an enormous campaign. But if you're doing something on a smaller measure, you might just need a leaflet or a newsletter and post it through people's doors. So it really depends on how big a scale it is. And depending on the scale, it'll also determine what sort of materials you need. So if you need posters, you really need a tech department to come and do all the design for you. We'll need to get a photographer to take pictures and things for you. Video, text, statistics, charts, graphs. These are the factors you'd think about. And then again, this is something that's already been designed. I've popped it on just to say the amount of work that would have been on, and they've got a photographer to go and take a picture. They've got permissions. It's probably a little model that they've got doing this. And this is on a national level. Just a few. And we've got an advert on here. I've got the link here. It's just telling you how to be safe and sound. An advert on YouTube. I normally do try to play these, but I found in all of the lessons that I do, whenever I play anything to do with audio, I can hear it perfectly well, but my students can't. So I've just been like popping these links in instead. And that's it. So nice and simple. You just get to talk about what sort of scale you're going to do a project on. And if it was a bigger scale, what materials you'd use. And if it's a smaller scale, what materials you'd use. You probably end up doing 2 paragraphs for here. So one on explaining how large a scale it would be, and then the second on what sort of materials you would use. And then 3.4, you're actually carrying out a health promotion project. So for this task, you're going to be asked to prepare a campaign report and use supporting materials. So you're going to look at initiatives. You've already got one. That you've already done a fair amount of work on. I suggest you just use that same one. Other options would be things and obesity. I've just mixed obesity and diabetes together.
Fine, don't worry.
So it could be obesity, diabetes, exercise, healthy eating, or have you ever seen those initiatives where it's with the primary schools and the high schools where they do the walk to school? And they're encouraging you to walk or cycle to school, and they get stickers or a little booklet where they can stamp them if they've been walking into school. So these type of initiatives. And then just like there's a promotion on deafness over here. So this is something like you would create. So you could use your project on fibromyalgia, have a little bit of an put the main body of your research and say, this is the project that I'm going to be carrying out, and then create a leaflet to go with it. So something nice and colourful. And then, do you remember that image that you used where it shows what areas of pain are on that?
Yeah.
That would be a perfect image to put into to create onto a leaflet. You could just have a couple of headings and extra bits of data, and it wouldn't take you long to use to actually do that. So going on to the last section, so evaluate the effectiveness and impact of the project. So now that you've actually carried out that project, now this is similar to what you've already done in your research again, which is why I wanted to do this next. Because remember when you carried out your research and then you went on to say what sort of recommendations you would make, you evaluated it, you talked about what steps you would do next. This is very similar.
Yeah.
So you've done that project, and now you want to act as if it's been handed out, and then you've got to think about, oh, how effective have this been? How much of a difference has it made? So you're thinking about now I didn't know too much about fibromyalgia before, but now when I read your research project, I know a lot more. So you can say that there's one person that has got extra detail, but it's something that's not as widely known. But once you put the information out, you're just going to see how effective is that information now.
Yeah.
So you're going to evaluate what you've done to make sure that you can continue your project. You're going to look at if any aspects of your project are successful. You'll also want to know how the funds that you spent on making these advertisements or these radio snippets or these leaflets, was that effective? Or can you use those funds to, do something else? Sorry, I've just got a very noisy child. Let me just go and ask him to quieten down.
You're all right.
So he was having a lot of fun singing on the toilet, so.
Oh, bless him.
And then you've got your process evaluation. So you're going to look at all the aspects of the process of delivering this program, so this initiative that you've come up with, this, and then how has it been. So you're going to review your activities or even your strategies, depending on if it was, remember, it could be a research project or it could be a physical campaign. You're going to look at what's been done, who you've actually reached, and was the quality of the activities that you used, was it good? Were these leaflets, were these adverts, were they actually good? And then you'll also be able to know that, oh, okay, I sent this leaflet out, I got everyone to put it through the doors, or I handed it out in the streets and people were just crumpling up as they were walking by. So was it worth the money that was spent on it? So these are some questions that you'll probably want to reflect on. So has the project reached the appropriate people? Are all the activities going to plan? If not, why aren't they? Were there any changes made to the activities? So if you decided that, okay, we've got this initiative here, I'm going to have a meeting, put this leaflet into people's houses, ask them to attend a meeting so that they can get some information on health improvement, how to look after themselves, and only 5 or 6 people turned up, then you're going to say, why was that? Should I have offered cakes and biscuits, or should I have given them an incentive where you get a free? Because I've noticed when you offer free things, people will turn up. So you can.
Oh God, yeah, we're like free pen.
Oh, seriously, we're always good for if anything like. I remember a lot of parents wanting to go into the summer fundraiser 2 years ago, not last year, only because we were going to have like free cookies and juice or something. So yeah, I was one of those parents as well. I've got to say so. We always love free things. Exactly. Then you're going to look at all the materials or information, your presentations. Were these of a good quality? Were there any spelling mistakes on them? What were they like? Because I'm a stickler for this, and I hate that I do it, but whenever I see a leaflet or a sign and I think, oh, that apostrophe shouldn't be there, or that shouldn't be spelt like that, these things jump out at you without you even wanting to do it. So it's quite important that you have good quality of grammar when you're doing like things that are going out into the media. And again, if it was a project that, for example, you've decided to get a case study on some people, and were they all satisfied, all these participants and these colleagues that worked with you, were they happy with how the research was done? You can get a feedback of them.
Yes.
So in total, you've got to carry out an evaluation and reflect on your own personal practice and the skills that you used. And then you're going to think, is there something I would change or keep the same? And you probably do this at work anyway, when you're in your office or on the floor, when you're doing things like, oh, I shouldn't have spoken to someone like that, or I should have put my foot down and said, no, this is what I'm asking you to do. So you do always reflect. Look at what sort of quality measures you put into place. So is there a limit on what you're doing? Is there some sort of basis that you're working off? And then you're going, what are you basing your success on this as well? So are you basing it off the number of participants that actually came to the meeting that you advertised, or are you basing it off the fact that you've spread awareness and people are talking about it? And say in 6 months' time, where you were getting 4 or 5 patients a day into a GP about a rise in diabetes, now you're only getting 1 a day to come in and checked out because they've improved their health. So what are you basing it off?
Yeah.
And then again, were your activities successful? Were they fully booked? Were they accessible? If there were people that had wheelchairs or mobility issues, were they able to get up those steps that came into the church hall? Or did they not have ramp access? What were the issues? And again, what are the benefits? So was there increased awareness? Were support groups created? Were there diet and health improvements? Were people motivated and confident? So just a few, just normal things that you would check against your successes and how effective things were on a normal basis.
Yeah.
And then again, how your types of evaluation on here. So in total, we've looked at the rationale of a health promotion project, so why they are there, how to gain permission, how to design materials. So we just talk about what you would do for designing materials. You'd physically carry out a project where you'll just use your research, an excerpt of it, and then you'll create a leaflet. So introduce it. This is the project I'm carrying out, and have a nice, fancy, colourful leaflet to go with it, and that'll cover that. And then evaluate it as if you actually physically put it on TV or if you physically put it through people's post.
Yeah.
So do you have anything you want to go over? Because I know we've gone through quite a lot of information today.
No, I'm just writing down to remember leaflet to post through door.
Yeah.
There's my notes.
It really does help later on, doesn't it? Because when you sit down to do your work, you sort of forget things, don't you? And then, I do that as well. I make loads of notes.
I am very much a person that once I've wrote it down,